An overhaul of the French health system is on the cards at this meeting, which will take place via video conference for health reasons and will involve around 300 participants from the hospital and health sector, as well as government officials, the health minister and President Macron, listening to the many complaints of health workers here in France who say they are the victims of chronic underfunding, that there are not enough staff, there's not enough budget, that they're the victims of budget cuts dating back decades. Now, France has traditionally had what's seen as a very good health system, ranking top or high in international rankings, but they say that the cuts are starting to show that they don't have enough capacity, that they've been really at a stretch with the coronavirus pandemic, and now they need more money. They want pay rises. They're demanding at least €300 a month pay rise. Nurses in France, their starting salaries are around €1,500, which is 28th out of 32 in the OECD ranking of countries. So they're saying they need to be brought up to the European average at the very least. There are also questions about working time, whether doctors and nurses and medical staff should be allowed to go over the 35-hour minimum. But this is going to be tough talks between the various health sector unions and the government.
And as you pointed out, Catherine, these issues are certainly not new, but the pandemic has, of course, once again brought them to the fore.
Yeah, that's right. Just going back last year to 2019, we saw months of sporadic walkouts and strikes among medical hospital staff, especially emergency room staff. The French Health Ministry's own figures show that visits to the emergency rooms in France doubled over the last 20 years, but staffing numbers and funding has not followed that. And for years and months, we've had doctors and people working in emergency care saying they cannot cope, that the system is about to collapse. So this is a malaise that's been felt well before the coronavirus pandemic, but of course that has brought things into sharp focus here. And we saw in France's response to COVID-19 that the French government mobilized the army, setting up field hospitals in eastern France, one of the worst affected areas, and using military aircraft and trains to transfer patients. It's been a real stretch for the French health system. But doctors are saying they want to see some of the flexibility and creativity and extra funding used during the coronavirus pandemic more widely during the more long-term future.